So, welcome to another episode of Smiles in the Air, your oral health and prevention podcast. I'm Celso da Costa, and today I'm sitting with someone who has completely reshaped the way that we understand aesthetic dentistry, a clinician who proves every single day that beauty and biology must walk together, that a smile can be stunning and healthy, predictable, and long lasting. I'm talking about Dr. Carlos Saiz, and one of the
Hello.
most respected names in aesthetic and restorative dentistry with more than 20 years of experience and three high end clinics in Barcelona, Madrid, and Marbella. Carlos graduated from the Universidad Internacional de Catalunya, and what makes him truly unique is his philosophy minimal invasive, biology driven, and always focused on preserving tissue first. He is internationally known for his work with micro veneers, ultra conservative smile design, and his ability to blend precision, science, and emotional impact. His clinics attract people from all over the world, and including well-known personalities, artists, and public figures. But what makes Carlos special, and that's what we connected last time that we were together, is that he treats every patient with the same level of rigor, humility, and aesthetic obsession. So, Carlos, welcome to the show. It's really a pleasure to have you here with us.
Hello, my friend Celso. It's a pleasure to be here sharing this moment with you and sharing my experience also with the GBT machine that we already have now in Barcelona and Madrid and Marbella. This morning we were using it a lot with all our patients, and well, I have to tell you that all the people love it.
Oh, that's great to know. Let's start from
Yeah.
let's start from the beginning, because for the people that don't know you yet, so how can you
Yes.
describe your journey that brought you through dentistry?
Well, it's a long journey because I started working in more than 20 years, as you mentioned before. Uh, I was doing a lot of aesthetics, but in my mind, when I was younger, I didn't like the idea of destroy the dental structure and shaving down the teeth, filing the teeth for creating a beautiful smile. It was something uh, weird because it doesn't exist something like this such a long time ago. And I started in 2008 with my technique of veneers without filing. It was well something super new, and now it's more common. But at that moment, uh, many people thought that I was crazy. My family, they were prothesists, and they thought I was crazy at that point. But well, after such a long time, now it has been a super success, and my patients are very happy because they don't suffer and they respect the structure of the teeth, and it do the treatment super safe for all of them because they can see all the process, and well, of course we do all kind of treatments in our clinics, but most of our patients come here for something aesthetic, and after, of course, we take an X-ray, CCT, and we do all the diagnosis of the rest, the gums also, of course.
You, you,
But I love
you
technology.
you just told me that your family is dental technicians, right? So
Yes,
they're coming from this prosthetic. Do you think that
yes,
that's what made you choose aesthetics?
I think so. I think so because when I was a child, well, I spent a lot of afternoons on the running on the lab, playing with crowns, playing with that kind of stuff, and probably, well, yeah, something make the switch on my mind, and and I decide to final well to final do a lot of aesthetics. But I have to tell you that at the beginning, when I was a student, when I finished my university, I started with surgery, with perio, with many specialities. with many specialties. And at the end is a good thing to have a global vision of the mouth of the patient, the prostheses, the gums, and because it's not only one thing. At the end, you have to manage many specialities to find the success of the case in the long term.
So you said that maybe in the lab you got that click, you got all the other experience, but what kind of experience really was the biggest influence for the philosophy and the approach that you have today with Smile Design?
What do you mean exactly?
So the aesthetics, we already understood that it's coming from the dental clinician's family and running on the lab and getting this part of the aesthetic. Is you also got a huge experience on the perio, on the surgery. But what kind of moments you realize that okay, this I need to have my own philosophy. I need to have my smile design approach. I need to get the aesthetic and the biology and also the minimal invasive all together. When you start realizing this and how you communicate to the patients about it.
Yeah. Well, honestly, it was something that when for example, in 2008, when I was realizing my preparations on the tooth, um, I was not very happy with this kind of treatment, so aggressive, and there was no information about no prep veneers, but I'm a very obsessive person. When I want something, I can spend hours reading, researching, and that kind of things. And honestly, in Europe, uh, there was nothing like this. But in the United States, I found a little clue. A big company that is not necessary to mention was creating at that point something very not invasive, we can say. And I was trying to contact with this big company from Spain,
Yeah.
and nobody was answering me. But I think that I wrote like 200 mails because I wanted to contact. And finally, the CEO of the company wrote me an email, and he was very surprised because I was like a little bit intense. And well, we have different mails, and I was trying to tell him that I really believe in that kind of treatment at that point. And he invited me to the United States. I was able to know the philosophy of the company, and after, well, we started to work together. It was very difficult because the customs for a medical device like this between United States and Europe was not open. And it was a little bit crazy because I only had one clinic at that point in Barcelona. I was much younger, but they trust me, and well, we started like this. And at the end, it was very difficult because many cases were was stopped on the customs. We had some problems. The patients were nervous, but well, with the time, I started working with another kind of labs in Europe, in Spain, training them with the philosophy, and until now that I have my only lab, my techniques, that they know what I really like, because my aesthetic is a little bit particular. I want something more with a lot of translucency, and now we are in a point very high, but it has not been fast, and it has not been easy. It's a long life.
Uh, you were proactive. You were also annoying because you wanted really to have this, what is really cool to see. You said that you were young and with a small clinic in Barcelona. The truth is that you are today in three major cities: Barcelona, Madrid, and Marbella.
Yeah.
So, and you have your philosophy into place. You have your own lab. So, how you see the future? What kind of mission do you bring now that you reach that level that now you are applying everything that you always dreamt of? What is the next step
For me, or for dentistry?
for you and for dentistry? I would love to hear your opinion about dentistry in general too.
Well, I think since dentistry is digital, you all of us we know that everything has changed a lot,
Yeah.
very, very, very fast. We were at probably one of the clinics of the world that we started with digital dentistry years ago. Now I think it's completely necessary to have a digital scan in a dental clinic. If someone doesn't have yet, it's something that it's
It's
completely
a must.
necessary. It's a must. I think now it's completely a must. Of course, I travel between my clinics in Madrid, Barcelona, and Marbella, but I have teams also. I do my job, but I have teams very professional. My future, well, I don't know exactly. Maybe I don't know if I want to expand more. um, we have to be careful because sometimes we want if we want to provide the best quality, expand is a good idea, but it's not easy. Then we will see. We will see. Of course, I'm not doing everything in my clinics. I have super good professionals working with me. And about dentistry, I think we are going to see a lot of amazing things soon with the AI. We are working already with the AI, for example,
Yeah.
yeah, with for diagnosis of the X-rays or digital scans. This is something that we are using already, and the patients are super impressed, and we also. Uh, but we will see with stem cells, regenerative, something. I think everything is going to change so fast that in 5 years, probably dentistry will be completely different, less invasive, a lot of prevention, of course. Uh, yeah, that kind that this is my in my mind. I have something very futuristic, but very realistic also.
That's the beauty of the field that we are in. Dentistry is evolving so much on the last years, and I think we will continue to evolve. Even if today AI is in the mouth of everyone, AI is already present since a while in dentistry, right? I hear about
Absolutely.
this diagnosis, and the first time that I saw it, I think it was 7 years ago, where they were using already AI to do the caries diagnosis on the X-rays. With okay, the success rate, there was a lot of false positives at the time, but now is not the case anymore. We have a 95 to 98% uh, excellence in terms of the diagnosis that is bringing by the AI. And I think the roles of the clinicians will also change. They always are afraid, hey, AI will never replace a clinician. No, AI won't replace a clinician, but they can be used as a tool to improve the clinician success rates and to improve also the less invasive style that we are also promoting so much.
Yes, absolutely. They are amazing. There are amazing tools now in the market. Of course, I spend many hours week doing research and seeing a little bit, the future, and sometimes trying these tools at the clinic, as I mentioned before, and well, it's amazing. It's when you can take not only the X-ray on the clinic, but at the same time you can have an informed with all the pathologies that you can see, the quality of the bone, the quality of the density of the bone, many things that we can use, not only the aesthetics.
Yeah. So you already shared so much secret traits that you have. One of those is like be relentless. No, always like push till you get what you want. That's what you did with these 200 emails that you just said before. You also said something that stick with me. That is, you have excellent teams, and I think this is also something that sometimes we don't understand how much is difficult to build a team around it. But if you had to
It's
define
difficult.
this, it is super difficult, right? Like I completely agree. But if you had to define your secret for building and sustaining a successful practice, what would it be?
Honestly, it's difficult, as we mentioned. My philosophy, it has been always very, very clear to be very respectful with the patients first, of course, um, and with the and with the mouth. Then all my teams, they have to be like me, because sometimes, of course, I'm not everywhere. I'm not in all the clinics at the same time. I'm with a phone, probably yes, but they have to, and they do, they to follow my philosophy, my steps. At the end, most of the patients wants the same. They don't want to suffer on the dentist. They don't want pain. Then they hate the word dentist. If you're able to change this little thing in their minds, they will love you. And and we have it, and we have this because at the end we talk about with them, we respect what they want. They don't suffer on the dental chair, that this is something that they all want. At the end,
Yeah, yeah,
it doesn't matter if they are famous or if they are not. All the people is the same. They want to be treated like humans, with no pain, and at the end, of course, with a perfect result, and something to maintain in life in a long term. It's not so complex, the
yeah.
idea, but well, at the end, it's something that we have to work every day, speak a lot, and it's like this.
Yeah, well, I had some of part of my team on one of your clinics meeting you, and they said how humble you were and how you took the time to talk with your patients. So if even them that were just visiting your clinic, they saw this, and then when you were here with me, we were talking about it, and you said I treat every patient the same, famous or not, and you just said exactly
Of
the
course.
same, and the expectations basically they are the same from a famous patient or a common patient. So and you want to have the best results, but how do you manage this pressure uh, with personalities or we with what we say not well, but the standard patient? How you manage this pressure, because they are putting their smile into your hands, and you have this pressure that they will get out of the clinic with their passport again, with
Yeah,
their
yeah, yeah.
smile that is really important to stay healthy, but also aesthetic. How do you manage this?
Honestly, it's not easy because in my clinics, probably in many clinics is the same, but I only speak about my experience. Uh, the expectation of our patients is super high because they have Instagram in the
Yeah.
hand, on the hand, and they want that. And sometimes they are not searching exactly nice teeth. They are they are searching something more like status or something like this, more psychological.
Mhm.
And they have little, I don't know, traumas or complex, or and they see pictures of people, and it's like, okay, if this personality is going there, it will be for something. And they see the pictures of the cases after, before and after, and the expectations are high. The pressure, of course, is high. I'm not going to lie you. It's not easy, but well, it's our job. We want this,
Yeah, we
and
want
and
this.
and we are here for that. Then we have to offer, of course, the best experience in all the senses since the beginning, since they call, since they write the WhatsApp. All the team has to be trained for that, because at the end, well, of course, I am the doctor, one of the doctors, but we have secretaries, we have a lot of people is working here, a lot of people is involved, and the philosophy has to be in every single mail, every single WhatsApp, because the chain is very easy to get broken if it's
Break.
not
Yeah.
like this.
Yeah.
Then, of course, we have a lot of meetings with the team, uh, almost every day, almost every week, about talking about philosophy, talking about, hey, I don't really like this point. You have to improve this, or because sometimes we are in the routines, we are stressed, and I don't know, it's easy to get relaxed and forget a little bit. Hey, no, I'm going to awake. I'm here. Okay, I'm here, and everything has to be perfect because this is what they want. Sometimes people is traveling from far away to
Yeah.
see us, and as I told you, the expectation is quite high, and the pressure is high.
Yeah.
But well, it's not easy. After we have to search a little bit of escape valve, like sports, or I don't know, um,
Find the getaway
relax.
to relieve the pressure. Yeah.
Yes, yes. But as I told you, this is something that I want,
Yeah. You are looking for
and
it. Pressure is a privilege, right?
I'm looking for
So
it, and this is the way that I choose. Then I'm not going to complain. Sometimes many patients tell me, are you tired about traveling between the clinics? And I'm telling, well, this is something that I choose. I'm not going to complain to myself.
that's good. But I'm curious, what is the most unforgettable reaction that you have seen when a patient saw their new smile?
Honestly, every day we have reactions, crying. Every single patient is different. It's amazing, and there are people who is more expressive. Uh, for example, now that I'm living here, and because I'm living in Marbella now, I'm originally from Barcelona, but I'm living here, and it's quite interesting because now I have 3 points of different view, and the people is different. The patients are different in Barcelona, in Madrid, in Marbella. The mentality is completely different. Here, for example, this is like a big bubble. It's super international. In one day, we can see patients from all around the world, and they are different. They have different ways of communicate with you. Um, and at the end, you have to learn how to manage everything. It has been quite difficult, honestly, at the beginning. Now I think we got it, but well, reactions, it depends. Sometimes yesterday, one patient from United Kingdom, she was laughing and crying at the same time, and hugging me, it was very nice. But sometimes there are people very happy, but they are not so expressive, and it's not bad. It's okay. We have to be very respectful with this. At the end, we have a protocol very safe because they can see everything before. Then there is no surprises. We don't want surprises. We don't want surprises, and aesthetics is not a good combination.
Yeah.
And
Yeah, exactly. True.
no, for both, for the patients and for us. And at the end, the reaction is something predictable because they can see before, and when everything is finished, well, of course, we can see something more emotional sometimes, but it's nice. It's nice. We change lives.
Yeah, yeah, exactly. You are changing lives, and that's the funny part of the job, right? To provide us a smile again to our patients that are looking forward for it. And I like what you said. Surprise and static doesn't match well, and I think that's
Mm-mm.
the beauty, that they know what to expect because you already have done the follow up with them. But how you pass then the next step, because once the smile is there, then we need to protect it, right? We need to prevent
Of course.
protect the work that was done in the mouth of the patient, to protect this smile
Yes.
and to keep it for the rest of their lives.
Yes. This is very important. What we do now this moment,
Yeah,
since we are using the GBT machine and all the protocol, uh, we teach a lot the patient before starting the treatment, or at the first steps of the treatment.
yeah,
For example, with the first dental cleaning before having the veneers or
yeah,
having the whitening. It's like, okay, we have to treat everything like this since now uh, until
yeah.
the next years, and we follow all the steps. In fact, something that we do, I don't know if you do it, but I do it, and it's very interesting. It's when we are using the disclosure,
Yeah.
uh, we take a digital impression.
Oh, you do the scanner with the disclosure. That's smart.
Yes, yes, because sometimes with the mirror, it's like they are not very comfortable with the mirror in the hand, and with the obtragate, and then we apply the disclosure. We don't show. We take the digital impression, and after, when everything is super clean, we compare.
Oh, where was with the biofilm?
Yes,
Now we
and
don't
this
have
is
it.
very
Okay.
and this is very useful. This is very useful because with the screen, now the quality of the digital impression is super high,
Yeah.
and it's like, look, you were like this before, and take a look now in the mirror, and it's something more positive for them to see the mouth super clean at the moment. And after, when we will finish with the, for example, if veneers or crowns or bleaching or whatever of the treatments that they choose, we reschedule, but they love it. They love it. Sometimes I have patients that they want to come every month.
Because it's softer, right? It's kind. It doesn't make any damage. They feel okay, and you can have this comparison, right? That's smart to have the digital scanner.
Yeah,
You even integrate the digitalization of your clinic in the GBT protocol, which is incredible.
yeah. And most of them, the first time, I can tell you that 80% of the patients are scared about dental cleanings,
Yeah,
regular dental cleanings,
yeah.
and they ask us for anesthetic, for example, and I used to say, okay, we are going to try my way. Trust me. No, 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 no. Please, I want anesthetic. Trust me. You will tell me after, and I can promise that. 100% of the patients with the GBT machine has no pain.
That's
It
that's what we
doesn't
want.
matter if they have the gums retracted, if they have a lot of inflammation. It's not painful at all. It's amazing. They love it. Most of them, they used to say, "It's the best dental cleaning in my life."
I think that's the beauty of your practice, and I think that's why you are successful. There's three main things. First is that you are taking the patient as the patient, so you are talking with him, talking about expectations, managing their expectations, accepting the pressure of having their smile into your hands. Second one, you are providing the aesthetic that they are asking for. You are also pushing in terms of like what is important for them. And you said before that you are bringing to them the different culture and their different needs. And the third one is that you are keeping their smile in good shape with minimal invasive techniques and asking them to trust you, and then providing the the delivery that you promised them, right? The no pain. So I think that at least from this discussion is what I'm retaining. These three topics that are so important, and you keep it so keen into your daily practice. So correct me if I'm wrong, but at least that's what I get
No,
from
no,
this.
it's like this.
Yeah,
It's like this. We want happy patients at the end, and because this is easy for us, and it's quite easy at the end to rebook an appointment after the cleaning. Okay, I
yeah,
see you in 3 months, and they want to come,
they want to
of
come.
course,
Yeah, yeah,
because it's not a sacrifice. It's not, they are not going to suffer, and they want to maintain, of course, the inversion of the treatment and the oral health, of course. But we have to teach them,
yeah,
because we don't have to suppose that they understand what are we doing. For that reason, we
yeah,
start using digital impression in that cases, because sometimes they don't really, if you apply, for example, if we talk about the GBT machine, if we apply the disclosure, but we don't show exactly what is it, or we don't explain. Okay, they don't feel nothing, but they don't understand exactly what's the difference of the treatment.
yeah, yeah,
What do you have different? But if you show on the screen, this is the maximum exponent of the explanation.
yeah,
And of course, you don't have to repeat this process every 3 months if you don't want. They already know what are you doing now, but you have to
exactly.
teach them at the beginning, because like this, they value the treatment, and after it's very easy. It's very, very easy,
What
and
when
they
I'm
will choose.
doing when I'm doing my lectures, I'm always saying the same thing. The first role of a clinician is to be an educator. And that's
Yes.
exactly what we are doing with the disclosure staff, and by showing, and we are educating them. And sometimes we take the assumption, because it's so normal for us to brush the teeth, how to brush, how to do the dental floss, how to do the interdental brushes, but it's not for the patient. And the patient doesn't know where they need to act. And by doing the disclosure and showing them, they will understand, they will know how to do it, and they know why now.
Yeah,
Carlos,
absolutely.
if there's a what is the one message that you want to every clinician that are listening to us today remember after this episode of the podcast?
At the end, it's quite easy. We have to treat the patients as we wanted to be treated. Simple.
Simple. Yeah.
It doesn't matter the specialty that you are using. Implantology, perio, ortho, doesn't matter. And we have a lot of tools now. I think dentistry is an amazing profession, and now we have amazing tools that it can do it very funny
Yeah. Yeah.
if you want. It's not like before, and we will see in future in future, but close in 2 3 years. I think we are going to see amazing things in dentistry.
Yeah, I think that's it. Like going to work in dentistry is going to play with grown-up toys that we bought to our practice.
Absolutely.
So it's always funny.
Absolutely. Yeah.
Carlos, thank you so much for being on the podcast. It was a real pleasure to talk with you and
Always
to
a pleasure.
discover a little bit more your practice on the your daily practice. So thank you for that.
Always a pleasure, Celso. Have
Thank you.
a wonderful day, and well, we keep in touch.
Yeah, you too. For the ones that are listening to us, do not forget to subscribe our podcast in every platform that you used to listening to it. Can be a Spotify, Apple Podcasts, or even on YouTube. And remember the message from Carlos: treat your patients like you would wish to be treated. So I think that's a strong message. So subscribe and don't miss the next episodes.